Okay, I think we're ready to get started. Welcome. Come on, take a seat. It's great to see everybody. Just a quick little icebreaker. How many people have sneakers on? Or in your bag? I'm not bothering to change them, I think, today. But it's such a testament to how busy this week has become over the years and how much each of us probably want to pack in to these next couple of days. Really excited and honored that you have chosen to spend some of your time during Climate Week with us on what we believe is a really important topic of extreme heat and how that's affecting health and the health of communities that are particularly vulnerable to heat. I'm Paulette Frank. I'm the Chief Sustainability Officer at Johnson & Johnson. And, sometimes you hear this phrase that climate change is this exacerbator, this force multiplier of pre-existing health inequities. And we also believe that partnership is a force multiplier as well for positive impact. And that's why it's also an honor for me today to share the stage with some of our partners that we couldn't be more honored and proud to work with. We've been bringing this topic of climate change and human health to Climate Week for the past 7 years. And 7 years ago, I remember being on the stage, probably equally as nervous. I never get not nervous when I'm on stage. And I told this story about how my 5-year-old son at the time had been in the car with me, and we were driving along a highway, and we were passing some factories, and there were smokestacks, and there were white clouds of steam coming out of the smokestacks. And he asked me from the back seat of the car, Mommy, does that smoke make God cough? And, back then, and I still believe it today, that even a 5-year-old can make this intuitive connection between the health of our planet and our own health and well-being. And today we still believe that health and caring about our health, the health of the people we love, is a unifier. It unifies us all. It's a great motivator for action. And it's why over the past 7 years, we've brought this topic of climate and human health to this stage. We've covered different topics like around infectious diseases and climate change, women's health and climate change, and today we're going to be focusing on extreme heat and climate change. It's also an honor after 7 years of bringing this topic to Climate Week that there's an official health track in the Climate Week agenda, and that we are the first sponsor of the health track for Climate Week. So another really great honor. So today we're going to focus on extreme heat, and we hope that you will leave this room with some knowledge and some perspective and appreciation for how heat is affecting some of the most vulnerable people in our communities, and also how those communities and the leaders in those communities, and we're going to have one with us today, are essential to developing the solutions that can help these communities be resilient in the face of climate change. So I'm going to set it up with just 3 statistics, and then I'm going to welcome our first guest. So this summer, we experienced the hottest day on record, not once, but twice. During 1 week in June, over 60% of the world's population was experiencing extreme heat. You would be hard-pressed to find a single person that hasn't felt the impacts of extreme heat. And according to the World Health Organization, heat stress is the world's leading cause of weather-related deaths. So again, we think this topic is incredibly important, and most important for you to hear from the people who are in communities, in government positions that are focusing on this topic, and most importantly, focusing on solutions. So with that, I am going to introduce our first guest, Dr. Victor Zhao. Dr. Zhao is the president of the National Academy of Medicines, and he's also the vice chair of the National Research Council. And we'd like to welcome Dr. Zhao to the stage.
I'm not wearing sneakers.
But I bet they're in his bag somewhere. So we know he has a busy, busy schedule.
It's
so
my room.
Once again, thank you so much for spending some of your time with us today, Dr. Zhao. So first and foremost, can you help set the stage for people in the audience in terms of how does heat affect our health?
Well, you know, is it on now?
Yes.
Great. You know, today is such a cool autumn day. Hard to remember how hot it was here this summer. And hard to remember all the tremendous heat that the globe witnessed. But as Paulette said, it was said to be the hottest summer on record. Someone said it's actually going to be the coolest summer going forward. So now you see that our challenges are way ahead of us. Yeah, I think I'd like to begin by thinking climate in terms of how it impacts health very quickly and then focus on heat. So you can imagine, she said, extreme weather can affect your health, and that's for sure, and climate is a big one. But also air pollution, right? Cardiovascular, respiratory disease, mental health, vector-borne disease, and if you live in Africa, drought, famine, flood, you name it. So it's a serious issue. But extreme weather, from that point of view, certainly heat is the number one killer, no question. What does heat do to you? Well, dehydration, heat stress, heat exhaustion, heat stroke, and eventually you can even die from it. So it's a very serious issue that we're faced with altogether. Now, if you look at the statistics, aside from the number of deaths, just in US alone, every summer, every year, goes 60, 70,000 ER visits. But this last summer, 10% increase. So there's no question that this is a serious problem. Now, what happens to your biology? I'm a cardiologist. I studied physiology, and this is a particularly interesting topic because when you think about how do you actually cool down your body when you get hot? You sweat, right? And that's really important. You pan, you sweat through the respiratory tract, through your skin. But when you have severe heat, suddenly your body shuts down to say, boy, I shouldn't lose all that fluid. I need to concentrate this. But that actually increases the heat of your body altogether. As your core temperature goes up, there you start affecting cardiovascular system, the central nervous system. You go through heat stress, exhaustion, and then you can have heat stroke, getting to cardiovascular collapse altogether, and of course, dizziness, loss of consciousness, and eventually, you can even die from it. Now, when your body temperature gets up that high, when it's really hot, outside maybe 95, and get up to well over 100 degrees, that is really dangerous. But it's not only the severe heat event, but heat itself, if you're exposed to it acutely or over time, can cause itself aggravate conditions like cardiovascular disease, respiratory disease, you name it. Actually, as we talk about the vulnerable population, those with chronic illnesses, those who are older, but women, pregnant women, it actually leads to early preterm deaths and severe problems altogether. So I would say that cardiovascular disease is a major issue, as is respiratory and others. Oh, I forgot to talk about kidney failure. I mean, that's another area that you can, severe dehydration, and I think ultimately you can get what they call total organ failure, and of course, you die altogether.
So I think most of us intuitively can understand things like heat exhaustion and heat stroke, but we don't necessarily think about the impacts on cardiovascular health and kidney health. Can you also dig a little deeper into how heat particularly affects already vulnerable communities and populations?
Yeah, we talk a lot about vulnerability, communities, and population. I look at it from 2 points of view. One, those who have conditions that put them at greater risk for heat-related illnesses. And secondly, where you live, in the environment. So if you think about conditions, those people who have, diabetes, hypertension, cardiovascular disease, you name it, are really, exposed to this, those with disability, right? The elderly population. I mentioned the pregnant individuals. But I think we all recognize that people of color and others, indigenous people, are a lot more vulnerable. Why? Because of not only chronic conditions they have, but they also live in the really, areas that's excessively hot. There's no access to cool and whole bit. So I think socioeconomic factors also play a big role. So that whole collective group of individuals are at risk for heat-related diseases.
Thank you, Dr. Zhao. So we are here today to predominantly talk about adaptation and the resilience of communities.
I forgot to mention outdoor workers too.
Yes, people
Maybe
work
we want to talk
outside.
about a little about that too. People who work in agriculture and farm, people, construction workers, they're exposed to really severe heat almost all day, and they are also vulnerable.
Thank you for bringing that. That's an important point too. So we are here to talk about resilience and adaptation, but the other side of that coin is still a lot of the important work we also have to do to decarbonize, and in our world, decarbonize the healthcare industry. Can you also touch on how the National Academy of Medicine is supporting and facilitating the decarbonization of the healthcare industry?
Well, first, I have to thank you being part of the what we call collaborative. We have decided about 3-4 years ago that the National Academy, for those who don't know who we are part of the National Academy of Science, Engineering, Medicine, which was founded back in 1863 to be advising the government, Congress, and others. But we've expanded our footprints substantially, work with Paulette, with industry, with academia, with hospitals, all together trying to find solutions. So the National Academy of Medicine a few years ago said, this is such an important issue. How can we contribute? So I guess our best power is convening and advising policymakers. So what we use is we use our organization's convening strength to bring together people to say, how can we all collectively address this issue? Because no single individual and no single organization can do this alone. So we launched a thing called the Grand Challenge, which has a whole range of activities. Let me focus on two. One is how we as health professions get together to contribute to low carbon emission, decarbonize the entire health sector, and second, how do we work with communities who are particularly vulnerable. So we launched these initiatives and all bring together industry. J&J's been a big player, as is others. We have Medtronic, GSK, many others, along with hospital leaders, along with, in fact, government leaders such as the Assistant Secretary of Health from HHS, who's overseeing the whole area, and of course the Office of Climate Health and Equity, the person who runs it, John Balbus. And we have academia, we have lots of others. So we come together to say, let's do this together and not alone. So we set goals to go forward with actions together to decarbonize and to look at what do you need to do on changing your healthcare delivery altogether, right? I mean, you'd be amazed how much we contribute to carbon emission in this country. Health sector contributes 8.5% of carbon emission of total US. And health sector globally is 5% of global emission. That's huge. So that means that we not only should take care of patients, but we should do no harm. So a big part of it is to say, how do we change care delivery? Maybe more virtual care, more prevention, less high-end care, and I can go on for a while, but I'm going to stop here. It's exciting to say that industry plays a really important role because about 67% of carbon emission from a sector come from supply chain manufacturing. So having you at the table and McKesson and others who are working together say, how can we together reduce this? So we have got goals, measurements, work together, and we just launched this last April a movement, if we will, of saying anybody can join. Let's have a movement towards climate and health. And today we have about 770 organizers joining us. We invite all of you to join us. Just say we believe this area is important. That's the starting point. then we can talk about how can we do this together.
Thank you. And when we talk about systems change in this space, it does require all the actors in the ecosystem to come together, and it requires a convener, someone to bring us all together. So thank you for that. Last question, Dr. Zhao. The National Academy of Medicine is also working on community resilience in the face of climate change. Can you talk a little bit about that pillar of the work?
Yeah, I think equity is a really important issue. I already talked about extreme heat. The same population vulnerable to heat are the same population vulnerable to climate change. So you're going to have to think about what do we need to do there. So we launched a program called the Climate Community Network, which look at using a heat map across the country, all those communities, from county to county, which are the ones which are most vulnerable to climate change, at the same time more marginalized as well, socioeconomic issues. And I see Michelle Topless is there, as well as Chris Henley's here from our staff. So we mapped them. We took upon some 18 communities which are really high risk, bring them together. We co-convene with what we call strategic partners, who are EPA, HHS, foundations, industry, to say, how do we actually listen to you, have your voice? How do you help you co-create solutions? What are resources that you need? So that's what we're working on as well.
Thank you. Thank you for that. Dr. Zhao, I want to thank you again for joining us this morning. I know you're going to spend a little more time with us and then you're rushing to your next event, but thank you so much. Please welcome.
Thank you.
And I'd like to welcome Nate and Crystal. So while we're getting settled in for our next panel, really excited to have Nate and Crystal with us today, and I'll just share a little bit about the work that we've been doing together over the past couple of years. So back in 2022, we announced on the Climate Week stage a partnership with AmeriCares and Harvard School of Public Health Sea Change program to focus on healthcare clinics in very vulnerable communities and to help them build some capacity and resilience to be prepared for the effects of climate change. And the first focus area was on heat. Nate is the associate director at AmeriCares, which is one of our partners in this work. AmeriCares is a relief and development organization that supports over 4,000 clinics, health clinics across the world. And Crystal is with us today from the Southwest Louisiana Center for Health Services, which is a network of nonprofit healthcare clinics. She's the chief nursing officer for that organization, and really, really appreciate you both being with us today. So back in 2022, we announced a goal to reach 100 clinics in the United States. In 2023, we announced the first 10 clinics that were in the pilot, and this past summer, 40 clinics had gone through an assessment process to identify the things they needed to do to be prepared for heat waves in their communities. And some of the clinics that were part of that 40 are in Crystal's network of clinics that she serves. So Nate, why don't we just start off with the program, and why is this particular program important to AmeriCares, and how have you seen heat in particular? Why did we pick heat as the first focus area for the program?
Yeah, thank you for that question. So as you mentioned, AmeriCares is a health-focused relief organization. We've been responding to emergencies and disasters for 45 years, many of which are extreme weather events, which we see are becoming more frequent and intense due to climate change. So we knew we had to really focus on climate change in addressing these issues. We partner with close to 1,000 free and charitable clinics and federally qualified health centers across the United States. These clinics, like Crystal's, care for people that are uninsured, underinsured, and low income, which the research shows are more vulnerable to the impacts of climate change and heat in particular. We also know that these clinics can serve a really vital role in supporting community responses to extreme heat. They're a trusted source of information, they understand their patients' unique health conditions, and they understand the barriers their patients face to staying cool and safe. So this was really the motivation behind the Climate Health Equity for for Community Clinics program. AmeriCares, in collaboration with Harvard Chan C-Change and frontline clinics such as Crystal's, we created an innovative assessment tool that generates customized heat health action plans. I know this sounds a little abstract, so I'll walk you through what this looks like. A clinic will fill out an online assessment survey that asks them some basic questions about their staffing capacity, their resources, their patient population. And then from that, it generates a customized plan that includes 5 recommended interventions for the clinics or health centers to carry out. As you mentioned, we had 44 clinics this summer generate plans and start to implement. And by end of next year, we're going to have over 100 clinics doing this.
Thank you, Nate. Crystal, Chief Nursing Officer, can you share with the audience what your role is as the Chief Nursing Officer, and also give us an idea of what the clinics are like that you serve?
Sure, and thank you for having me here. So I am the Chief Nursing Officer of SWA Center for Health Services. As Nate said, our organization has been around for helping underserved communities for the last 45 years. My role as the Chief Nursing Officer, I'm responsible for all of the clinical operations and care coordinations for all of our patients. We do care for patients from actually pediatric to geriatrics. We offer a wide variety of services, mental health services, behavioral issues, pediatrics, primary care, and maternal child services. A large population of our patients, 70% of those patients are Medicaid. A lot of those patients salaries are 100% below the poverty level. So what we try to do is to be able to reach each patient where they're at. And sometimes with limited resources, it can be challenging. So my role is to coordinate not on just a local level, but also a state and a national level to be able to bring those resources in our community for such a time as the issues that we've seen with heat-related illnesses.
Well, thank you, Crystal, for also being a part of this program and for seeing and having the insight and the foresight that this was a topic and an issue that you had to get ready for and be prepared for. Can you share with the audience when you first started to see the changes in the community and the environment due to climate change and how that's been affecting the patients in your communities?
Sure. So last year in July, in Southwest Louisiana, we have temperatures 110 degrees. So in that July month, we've had temperatures between 100 to 110 throughout the whole span of July. The leadership team had an aha moment when on one day, it was the weekend prior to the 4th of July, we had triage over maybe 10 patients that came in within not even an hour time span with heat-related illnesses, exhaustions, from the pediatric population with asthma type-related issues to the adult population with exacerbations of some pulmonary issues. And at that particular time, once we triaged those patients, we realized a lot of that was related to heat. Out of the 10 of those patients, 5 of them had to be hospitalized in an ED department that's already bottlenecked with patients. So as a leadership team, we really had that aha moment because we had patients vomiting in the lobby. We had some patients diarrhea in the bathrooms, all of these things particularly related to heat. Now, they were going about doing their day-to-day activities and just showed up to the community health center. So some of these patients were patients connected to us, and other patients were patients who basically, knew that we treat a variety of illnesses. But that was our aha moment because we realized the heat actually from all populations. It impacted the kids to the adults. We've seen a lot of low blood pressures, very, very low blood pressures. We've seen a lot of tachycardia, and we realized, hey, this is all related to the heat. And so that was our moment where when we actually worked with Nate to start developing those heat action plans, because this is what day-to-day for Southwest Louisiana. So this is something that you could get used to. So think about it in an area where it's always 90 degrees, 100 degrees, sometimes even in August, September, where it's cooler in other areas. These are the things that sometimes is normalized in those environments, of treating those patients.
Thank you, Crystal. And could keep us in the clinic and share with us what your experience was like actually using this tool and what some of the interventions that you identified would be helpful in your clinics.
Sure. So when we looked at the assessment tool from AmeriCares, we had already been really looking at our processes to see how, as a healthcare organization, how can we actually be able to identify vulnerable patients, meaning patients, some of these patients don't have air conditions, believe it or not. Some of them have only box fans. So we wanted to be able to get a really good assessment of our patient population's needs. So as you all know, there's drivers of health. So we also deal with issues of transportation. We may deal with issues of being able to just have that access. So what we did was, when we looked at the assessment tool from Nate and also the tool that we utilized, what we did, we kind of bridged that where we could get a better assessment in the springtime of exactly what resources maybe that we can help to contribute to the well-being of our patients to combat some of the heat-related issues. So one of the things that we did realize that just from how do we respond to all of this? So we ordered more cold packs to make sure we have that available. A lot of those patients were fainting and passing out. So we had to actually increase our supplies on hand to address these things. Another thing that we did was we partnered with local communities. So from that assessment, it's like a referral. So we actually partnered with several community agencies to see who could provide some of those resources for us as fans, those types of things. Also, what we did, we partnered with some of the colleges. So we actually participated in more of a network where sports is a big thing around the 4th, so where they could put cooling stations in those areas where, they're playing softball or football or those types of things. From a leadership perspective, what we really realized is basically we were hit really hard, our organization, because we had 2 hurricanes the previous year, and we lost almost 40,000 square feet of basically just our workstation. So one of the things that we really wanted to do is have an empathetic approach to our staff, because not only did the patients have a lot of anxiety sometimes in regards to climate-related issues, our staff was dealing with some traumatic, incidents where some of their homes were lost with the hurricane. And so we really looked at it from a broader perspective. We did include heat as a part of our equity plan. Currently, we had maternal health, we had hypertension, we had diabetes, and so we included heat where the leadership could be directly involved with decisions. So heat is our normal topic every week. That's a part of what we do, because we want to make sure that we're giving our patients as well as our staff the opportunity to be prepared.
Thank you, Crystal. What strikes me is some of the interventions are quite simple. It's more about being prepared and planning and ordering more supplies. How some of the interventions bring the community together, because everyone is trying to, address this topic together. And then the point about the healthcare workers also being under some of the same stresses as the patients that they're trying to serve, and how do we take care of them and help them serve. So thank you for bringing up all those good points. Nate, can you talk about the interventions at a broader scale? Now you've seen about 44 of these heat action plans. Are there some interventions that are in common or kind of universal across the landscape of clinics that you're supporting?
Yeah, no, what's incredible about this project is as the 44 clinics implement these interventions, they're tailoring them to the local context. They are focusing on certain ones, like sharing critical information. So when there's extreme heat in the forecast, they'll reach out to their patients to warn them. Often this will be accompanied by information about what they can do to stay safe, and other community resources that are available, such as the location of cooling centers or transportation resources. I can give some really exciting examples about what we're hearing, what they're doing. I mean, what Crystal said is one of 44 different kind of ways that people are approaching this. Some of the clinics, for example, are kind of, those that care for people that are unhoused in urban settings. One clinic is partnering with a local coffee shop to set up hydration stations for their patients because they know that their patients need access to water during extreme heat events. Another clinic is partnering with the local school district to leverage sport physicals as an opportunity to educate student athletes about the dangers of extreme heat and symptoms they need to be, aware of. Another clinic who cares for kind of older adults that are over the age of 65, they're doing in-person wellness checks on these adults, especially those that live alone and with certain health conditions that put them at greater risk. So I think one of the really exciting things we're seeing about this project is there's certain things they're doing, everything looks different, even though there is, some kind of consistency across, like sharing of critical information.
Again, a lot of those examples show the community kind of coming together and, to address this together. So you both have probably learned a lot through this process. How do each of you share your learnings with others in your networks? Crystal, with you, with other nurses and other chief nursing officers, and Nate, across your network of peers. How do you share?
Yeah, so I'm on several advisory boards. Also, in Louisiana, I'm on LPCA, which is the community health. Basically, we all get together and we share that education. One of the biggest things that we've known, everyone has known, basically education is a big thing, whether it's through social media, whether it's through being able to reach that patient where they're at. So we focus a lot on basically what works in our environment and what works in our setting. So there's not a one-size-fit-all type of solution. However, it allows us to be able to look at best practices from other organizations to see what actually works. And then just from the nursing component of it, it's very, very important to get the buy-in from the team, from the clinicians. A lot of times they'll discuss how's your health today, but no one really discussed, some of the heat-related type things. So we actually did scripting at our organization from the front desk all the way to when the patient is actually admitted in the waiting rooms to be able to actually identify heat is very important. And so I think on that local level and also on that state and national level, we've actually, Nate and I was at a heat summit at Duke University collaborating. So I took a lot of that information back to my community sector. So it's really just the networking throughout awesome. And just sharing the best practices.
Awesome. Thank you for getting the word out. Nate?
Yeah, so when we did the kind of foundational research for this project, we looked to see what exciting things were happening to address heat at the community level. And what we found was it's really hard to find what's going on. We found some local, news stories that were sharing it, but that was pretty much it. So we knew from the beginning we had to build in this kind of sharing piece to this project. So with the 44 clinics that are participating in this project, we have them participate in multiple focus groups where they're able to share what they're doing with each other, learn from each other, talk about how they're contextualizing their intervention for the local community, challenges they're facing, and then we're going to be capturing these stories as case studies that we're going to feed back into these plans. So as future clinics and health centers generate plans, there'll be case studies for them to learn from and to be inspired by.
Awesome. We're looking forward to those. So last question, what's next? What's next for you, Crystal, with this program? And Nate, same question.
So we really want to track the data. We really want to see if all of these efforts that we have made actually help decrease ED admissions, help decrease the type of heat-related illnesses that comes in the clinic. And so I feel like we have a benchmark now because we've kind of set in play the playbook per se. So we want to see, a year from now, if, based upon that information that we have provided the patients and the interventions that we have done, if it actually makes a difference and impacts the decreased ED visits and the decreased health-related, illnesses as it relates to those extreme temperatures.
Love the focus on a key metric, going to actually measure impact of the actual interventions. It's super. Thank you, Crystal. Nate?
Yeah, so I'm excited to announce that AmeriCares, in collaboration with Harvard Chan Sea Change, is actually making wildfire smoke action plans. So we're building off what we're learning from this heat health action plans to really help clinics and health centers prepare for the impacts of wildfire smoke, which we know is becoming more frequent and intense due to climate change.
The work continues.
It does.
Fantastic, just the beginning. Thank you so much, both of you, for being here with us.
Thank you.
So our third and final panel of our session today, Eleni, I'd love to introduce you to the stage. I was going to call it the hot seat, but
I'm like a panel all by myself.
yeah. Welcome, welcome. So for those of you who haven't seen Eleni's many talks, which I have, Eleni is the Chief Heat Officer for UN Habitat. And I'm going to ask you to, let's start with right there. Chief Heat Officer, we've seen this role. I think Miami and Los Angeles have a Chief Heat Officer. Can you share with us what this role of a Chief Heat Officer is and how it's evolved, and a little bit more about UN Habitat, where you are now the Chief Heat Officer? I think it's on.
Hello.
Yep.
Hi. Thanks for having me.
Thank
it's great
you
to be
for
here.
being here.
So I used to be the deputy mayor of Athens, and started realizing, with kind of trying to figure out the resilience strategy for Athens, that heat was a really big issue. And I was together with 100 different cities around the world at the time that were using the same methodology to build resilience in cities, not climate, just resilience generally, urban resilience. And I think Athens was one of the first cities of the 100 that actually prioritized heat. So then I kind of realized that the other cities weren't thinking about that. It's like 2017. So other cities weren't really thinking about heat much. And that, much more was done for flooding, for sea level rise, for other types of things. So I thought, okay, I have to really kind of jump on this and try to get cities to figure it out and start really working on action plans. Now, if you think back to 2017, 2018, nobody was talking about heat. Like, seriously, it's the last 3 to 4 years that we really are kind of understanding that this is like the #1 health issue. Like, it's the #1 killer around the world, heat. And it doesn't even compare with other other data that we get from other extreme weather phenomena. So then I started working with the Arch Rock Resilience Center of the Atlantic Council and with other city networks, and they created this position of the Chief Heat Officer. So what do Chief Heat Officers do? They are, they're basically trying to figure out how to help a city help the most vulnerable populations in the city, and also how to make the city cooler. So these are the basic two things that the Chief Heat Officer's mandate is, which means also, of course, working with all the different departments, working with outside stakeholders, working with communities, figuring out how to get the messages to the right kind of people, figuring out how to build capacity even among the health services, because people still, like people that work with the vulnerable populations, don't know how to recognize symptoms, don't know how to actually take down data that relates to their symptoms to heat, et cetera, et cetera. Like, we have problems with data, as you well know. So the Chief Heat Officer has like this important role of coordinating, of convening, of figuring out what are the things that really we need to do in each city, because heat is this weird thing, which is that it's very different, it's very localized, and it affects different cities differently. So I always think of it, and it's like this really kind of strange kind of vision of, like, heat kind of looks into the city and kind of goes and finds, where are my most vulnerable people? Where are the people, that they are the older ones, the younger ones, the pregnant ones, the people that are the poorest ones, the people that don't have good housing. Like, it almost goes and finds where are the weaknesses and hits those people. And we have to figure out each person, from each of our institutions, where is my vulnerability? Where is my exposure? And so basically, this is what chief heat officers do. They figure out where is the bigger result on your investment, on your initiative, and let's start with that.
So sticking with the role of the chief heat officer, I'm kind of curious how your role as chief officer for a city like Athens, how it compares and contrasts with your chief heat officer role at the UN Habitat, which is a very large multilateral organization.
So I always thought of approaching heat in 3 different pillars. And one is awareness raising, the second one is prepare. So awareness raising has everything to do with knowledge production and knowledge communication and figuring out how to get the message out. The second one is preparedness, which is like how during the heat waves, like during the crisis, how can we be best prepared for the moment, and how can we make sure that we have the right things in place so that things don't fall apart. So for example, our health system depends, as a lot of people in here know, depends on 100 other systems in order to be able to function, right? So in the city, we have to figure out, that do we have backups for electricity? Do we have backups for water? Do we have backups for transportation? Can we figure out how to kind of do all this so when crazy heat happens, we have enough people there to take care of people, enough blah, 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 blah. So it's all of this kind of thing that you have to figure out and make sure that also you have like the basic things like the cooling stations, the phone, the hotlines, the whatever, like all the way up to insurance that they're starting to create this great insurance tools, which is called parametric insurance. So like, for example, in India, we've been working with SEWA, which is the Self-Employed Women's Association, and we created together with them this insurance tool, which actually allows them to get funding during the days of extreme heat, like when a threshold is hit, like they get some money, their wages, so they don't have to choose between going out and working in these crazy jobs and putting themselves into. So all of this is like during the heat wave, like what do I have like set up? And then the final thing is redesign. So redesign means, all right, all of this is not going to be enough because we're entering an era of extreme heat, and we're going to be dealing for the next few decades with extreme heat that we are not prepared for, our cities are not prepared for, our infrastructure is not prepared for. So we really have to rethink how we design our cities and the places where we live. And so this is like the third thing. So all of this, I think, can work on different levels. So you can work on these 3 kind of things, whether you're working in your organization, whether you're working in your city, whether you're working in, on a global level. And this is how I'm approaching things to keep my sanity a little bit, because if you have little boxes, you can...
Frameworks help.
Frameworks help, yeah.
I agree. So Crystal and Nate kind of brought us into the clinic setting and talked about interventions. Can you kind of zoom us out a little bit to the city level, and what are some specific interventions that you're seeing are most impactful? And then maybe at the global level, what types of interventions do you think are more universal?
So at the city level, the most exciting things for me are the nature-based solutions and really kind of pushing our cities to the limit of how much nature can we bring into the city to make our cities healthier. So these are my most favorite things, because that's kind of what can help the whole community. And there's many, and of course it's difficult because there are a lot of communities that are kind of scared of segregation, and they're pushing against green and blue infrastructure and nature-based solutions. But this is something that has to be co-designed with the communities and figure out how they can understand and how they can kind of find value in it. And this is like something that's really important. And this goes from cities per se, but also it's also very, very important. And I was right before I was in this roundtable discussion about informality. And there we have a whole other crazy, really difficult conditions that we have to deal with. And we have to remember that a lot of cities around the world have a really big percentage of their population lives in informal settlements, and they're dealing with extraordinary heat conditions exactly because the houses are so bad. So, like, we have to stretch our understanding and understand that in every city, even in the richest city, like in Phoenix, Arizona, we heard these crazy things where the clinics were not able to deal with people coming in with third-degree burns because they were burning from being outdoors and homeless on grounds that were burning them. It's insane to think about these types of things in the US, in Phoenix today, but also we have to understand that there are people that are living in houses that they can't escape from, that have extraordinary temperatures inside, and there's nowhere to go because there's no tree. There's no common space that has air conditioning. And that's like 1 billion people around the world, and it's going to double. And so this is like a whole other thing that we really have to wrap our minds around and work with the communities to figure out what we're going to do, because otherwise the solutions are not going to be any good. So that's from the city level. On a bigger level, I was recently, on a national level, I have to say that I was really heartened by, I was recently in the White House because they had a summit for extreme heat, and I was blown away because really I think the US is the first country where the Biden-Harris administration has created a whole horizontal series of tools and resources and that they presented for each agency. So each agency, from the Department of Transportation to the IRS to the FEMA and NOAA and EPA mm-hmm. and 10 different kind of are putting together this extraordinary resources and tools and information and all of these things. And they have created also a governance structure called, I don't remember, whatever. They have a portal that's called heat.gov. So if you haven't kind of looked into it, please do, because I was blown away by how much work has been done on this, and that there is a coordination. It's really, I'm sure it's extremely difficult because I've lived it in the UN, extremely difficult to coordinate FEMA and NOAA, and it must be a nightmare. And they managed to coordinate all these different agencies and put together this. So this is, I think, a great example that because the UN Secretary General just launched a call to action on extreme heat in August. So part of the next steps, which is great, and again, it pulled together 10 different agencies to do one big document, which is fantastic, 17 pages long, which is the state of affairs in relation to heat and what different agencies are doing in the UN. So the next steps they want to figure out, what do we do? How do we help governments? How do we help member states? And I think that the model that the US has created could be, if we simplify it and make it more bare bones, et cetera, we could actually use it as a toolkit or a guidelines to then give to other governments, and then of course figure out how to streamline with cities, because that's where we have the problem. The funding and the solutions have to go to cities because that's where the issues are.
So you had mentioned a couple times, and it's come up a little bit earlier, this idea of co-designing with the communities in mind. We're talking about very vulnerable people who have fears. In your experience, what types of approaches have worked to engage very vulnerable communities who might be fearful of the process?
This is a really good question because I think that the health community has a really great role to play there because there is already usually relations of trust that are built with the health. I know that we had problems with COVID, but still, I think we still have a really strong hold there. And so, for example, we've been trying to build one of the things that of course is really important and has priority is the early warning systems and how do we kind of pass information. And part of it that we've tried to do in different cities is to create these heat health categorization of heat waves so that we can then link it to messaging and then link it to different initiatives. But you know, we still, it's still an issue, like how do we categorize heat waves? Why don't we have categorizations like we have for hurricanes? It's much more local, it's difficult, but it's really important. So the question was, okay, we have this information, we know what we have, but how do we actually find the way to make sure that we reach the communities that are the most vulnerable communities? So we have to go to these communities. We went to these communities in several cities. Athens was one of them. And we kind of, like, different communities, right? The older people, the kids and their caretakers, the people that have pre-existing conditions, like each, or the homeless or whatever, each one of these communities have different access to information that they trust, and we have to find what are the channels and make sure that we take those channels to give them the information. But part of it, a successful, for example, story is that, for example, the IFRC has been a partner in all this, and the Red Cross is has such, for example, and other organizations, but I'm just using the Red Cross because this is one of the ones that we partnered with, was so important because it was there was a built-in trust when somebody came from the Red Cross to talk to you, that was incredible, and we really need these people that are the doctors, the nurses, the volunteers for the Red Cross, the people in the social workers that already have established relationships of trust, that through them we have to make sure that we pass the messaging that people need, because a lot of people still don't know how scary and how dangerous heat can be to them and their loved ones.
Thank you so much for spotlighting the role of the healthcare workers and the nurses and the doctors who are part of these communities. Couldn't agree more on that one. So let's end on a note of hope. I mean, it's a daunting topic, there, no bones about it, and the solutions, while they can be simple, they're still difficult.
And they're not to scale yet.
And not to scale, and engaging the community can be complicated and has to be handled very sensitively. What does give you hope for the future?
That I see more and more people like here kind of engaging with it. I see cities being more ready. I see people talking about it. I see the media kind of communicating better. I see like the communities being better informed and better kind of getting ready. And this is really, really significant. But, we have to put pressure, and I'll finish with that. We have to put pressure on the mitigation side, on making sure that we get our governments and to make sure that we phase out fossil fuel, because no matter what we do on our side, we will never be strong enough and just enough to deal with the problem and the people that need help.
We highlighted that earlier today as well,
you.
so thank you for
Thank you.
bringing that up. So this will conclude our panel. Eleni, thank you so
Thank you
much
very
for
much.
joining us and zooming us out and giving us that global perspective. I want to thank all of our guests today, Nate and Crystal. Dr. Zhao had to leave for another meeting. But I hope, we started, our intent with this session was to give you some more knowledge about how heat impacts human health and very vulnerable communities, how there are solutions, and they don't have to be big and scary, they can be pretty simple. But the key to it all is that the community is involved and engaged in developing what those solutions look like, solutions developed by the community, for the community. It's so important. So no matter what work you're doing with whatever stakeholders that you're trying to come up with answers and solutions, involve the people that are going to be impacted, and they have to be part of those solutions for them to work, for them to stick, and for them to ultimately be scaled one day. So put that community at the center. That's the key message, hopefully. So thank you so much for joining us today.